Our son has cerebral palsy. He has multiple medical needs.
The Andersons have been taking every precaution to make sure their son Sean doesn't catch COVID-19. His weakened immune system means he's a high risk.
Here you go. Good job. There's only been the one person coming in and out and working with our son.
But 9 days ago, that support worker phoned Irene on a Saturday afternoon to tell her he'd tested positive.
I was absolutely fearful of what the consequences were likely to be, particularly for our son.
The national benchmark for notifying close contacts of a positive case is 48 hours. In this case, it took more than 50. Contact tracers say that's because there was a delay notifying them of the case.
We weren't contacted by contact tracing until 9:15 on Monday night. And to think that if the worker hadn't told us, we would have been in the dark for that length of time.
The faster your contact tracing works, the more likely you are to catch those contacts before they've become infectious and possibly infected others.
I just feel that families with somebody who is highly vulnerable need to know a lot quicker. I'm feeling relieved that at this point we've tested negative. We're hopeful with the way we're all presenting at the moment that we are okay.
That contact tracing process is really the key to actually containing spread.
As Melbourne emerges from lockdown, contact tracing will be critical to avoid a resurgence. Identifying and isolating everyone who's come into contact with a COVID case will stop the spread.
We are getting to almost 100% of every positive case within 24 hours. We're getting to literally 100% of all close contacts within 48 hours. They are national benchmarks.
Now, New South Wales has a stronger capability when it comes to tracing. And I should stress, it's just not about how many people you've got on the phone. Information systems are critical to this.
Of course, I'm aware of the commentary on Victoria's contact tracing. When we're dealing with day after day of 400 cases a day, we need hundreds of people on telephones doing those interviews. So the system has been stressed. We have made improvements, and had those improvements been in place 2 or 3 months ago, would our performance have been better? Then I think so.
Until late last month, Victoria's 2,600 contact tracers were using pen, paper and a fax machine.
The IT system that we use had our case interviewers on the telephones writing down the interviews on paper, and then that interview being typed in separately. But that paper-based system is exactly the same system that's used elsewhere in the country.
David Van Rooy runs a factory in the southeastern suburbs. He has 24 staff. In July, as Melbourne's second wave took off, one of his staff members tested positive to COVID.
He gave them my name and mobile number as being his employer. And so I expected a phone call within 24 hours. And of course that call didn't come.
It's been 49 days and David hasn't heard anything. He took matters into his own hands, isolating staff who'd worked closely with the man and cleaning sections of the factory.
We were kind of taking the bull by the horns, but again, kind of flying blind. We had a crack, but ultimately it would have been nice to have had a direction from DHHS to say, these are what you need to be doing. There's a lot of anger out there. People aren't trusting the system. People are feeling really let down by what's happened.
Late last month, Victorian contact tracing went digital. Software giant Salesforce agreed to show 730 the new cloud-based software purchased by the state government.
As a contact tracer, I'll be presented with this screen, which outlines all the fields that I need to fill in, including the names of the individuals who share a household, the close contacts of the individual.
And as soon as they're entered, they then trigger a SMS notification to the close contacts to say, you have been identified as a close contact.
The program logs people's symptoms and maps who else may be infected. South Australia and WA use the same software system, but there's no national database. So if a positive case crosses a border,
we would just phone the relevant public health department in that state. So if it was Sydney or Brisbane or wherever, we would just lift a phone and speak to them directly.
Whether Australia manages to suppress COVID largely depends on the success of our contact tracing systems. Victoria's at the tail end of its second wave. The real test will be when borders reopen.
If we can't completely get rid of the virus, or we can't protect ourselves absolutely from the virus returning to our communities, then ultimately our case control response is going to be a critical part to making sure that we never see another wave like Wave 2 in Melbourne.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.